Hey guys, welcome to Respiratory 2140. Here's another skills video for our lab. This video is going to go over nasotracheal suctioning and suction setup. So indications for nasotracheal suctioning are very poor cough, copious secretions, and certain neuromuscular disorders that might affect the diaphragm. So essentially, if you have a patient with a weak cough and you hear rhonchorous breath sounds, which is secretions in the large airway, then this would be an indication. I have my creepy assistant here. First, I'm going to show you guys how to set up suction, and then we will go into nasotracheal suctioning. So come with me. First off, you need your vacuum regulator, which is hooked into the wall. As you can see here with a pressure gauge. Up top, you can see we have off, full, or regulated. So at the moment we have our vacuum set to off. If we need full suction, say we have a really thick vomit or something we need to suction up, we can put it there. And then the reg we can regulate. Down at the bottom of then we have our knob, which we can adjust our pressures. And then down here, we have our suction tubing up to our canister, the top of our canister, where we have our suction pressure. We can close this off. If we need a second suction for some reason, we can place it here. And then our suction tubing, which at the moment we have attached to a Yonker, but we can take that off and have our suction tubing. So once everything is on, I'm going to put it to reg, because we want to regulate. And to get the proper suction pressure, you occlude, and you can see what pressure you're giving. For an adult, we like to use a pressure of anywhere from 100 to 120. So this is kind of high, so we'll bring it down. So the negative brings your pressure down. So we'll go to 120. So a few things with suction. I'm going to turn that off so we don't have that noise. With suction, you can be careful to cause trauma. If the canister's full or if there's a leak, you won't reach adequate pressures, anything like that. So we use suction a lot to clear airways, so get very comfortable setting up suction. That's just a short introduction. I want you guys to get hands-on with it. Okay, so with nasotracheal suctioning, again, we talked about indications. Let's talk about risks. Some risk of nasotracheal suctioning is epistaxis, so we can cause bleeding to our patient. Any type of mucosal trauma, pneumothorax is very rare but possible, and then just hurting your patient in general. We can place a nasopharyngeal airway, which I will show in our airway video. If you have a patient that's needing frequent suctioning, that will help to protect that nasal passage to prevent continuous trauma. So with nasotracheal suctioning, this is a procedure where you will be exposed to body fluids and body secretions, so make sure you use proper precautions. I suggest wearing a mask when dealing with real-life patients, and then wash your hands and wear gloves, because again, you're dealing with different patient body secretions. So inside these kits, they are typically sterile, but this is considered a clean procedure. So use clean to sterile technique. I took the lid off just for video purposes, but the top of this is still considered clean. So when I have a real life patient and not a mannequin, I use a water-based jelly lubricant to prevent any type of trauma and to help that catheter to slip into the nair. This is respiratory according to Allie. I prefer quite a bit of lubricant. I'll get like 3 or 4 packets, and I'll put about 2 or 3 so that I can lather my catheter up. And then I take a whole packet and I shove it into the nair I'm going to use. I am not skimpish with my water-based lubricant. That shouldn't hurt your patient, the lubricant, and actually it will help prevent any damage or discomfort your patient will experience. So you can either get your own gloves or the gloves within the kit. So I'm going to put those on. so that we have clean since we're dealing with body fluids. If you need to, you can get saline. That's appropriate. So I typically like to have a clean hand and a dirty hand when I perform nasotracheal suctioning. I'll use my dirty hand for opening, squirting, getting anything I need to open up, touch. And then I have one hand that I consider clean/sterile for my patient. That is going to go into my patient's airway. Inside, you will have your suction catheter. This is the end that will attach to your suction tubing. This is a thumb port that once it's occluded, you will provide suction. So at this moment with my dirty hand, I would attach my suction tubing while holding onto my suction catheter. You can also do this beforehand so that it's all attached. I like to just continuously hold this side so that it's not just flying everywhere, and then I'm ready to suction. On my clean hand, I like to take my suction catheter, pinch it in my fingers, and I wrap it up between my two fingers, and then I hold it so that it gets warm. I'm just gonna drop that. By getting it warm, we are going to add a curve that will help go with the anatomy of your patient and to help make it easier to move and manipulate. This is when I would apply my water-based jelly. Since we're a mannequin, our water-based jelly. So I bring it out, see how it allows it to curve. That will help follow the anatomy. So I'm going to keep it clean and sterile. In here, inside is still clean. So if you need to use it to help get any lubrication or any saline, totally appropriate. So you educate your patient what's about to happen, otherwise that's going to be a really terrible surprise. I personally find it easier to go along the nair that's on the opposite of what side of the bed I'm on, as opposed to the one I'm closest with. So you'll go straight in with an adult. And then follow it back through the curvature. A few tricks for you guys. If you go up with the nair, it will help drop it into the airway. Also, if you bring it out, it will move your catheter medial, and that will help drop it down into the airway. These are just a couple tricks if you get stuck with your while suctioning your patient. I'll also do what's called around the world, where I will twist it between my fingers like this till I reach the little spot in my airway, and then I'll gently just go around the nair until I'm able to drop in. So those are a few techniques I found that help me with nasotracheal suctioning. So we'll go in until your patient coughs or you reach resistance, and then you apply suction. You can only apply suction for 15 seconds at a time, and also make sure you watch for heart rate so that you don't do what's called brady or vagal your patient, which is stimulating the vagal nerve. And suction, and I'll come out a little bit and I'll apply suction again while your patient is coughing. I instruct my patient to cough. It helps you get more secretions. I guess best bang for your buck. So keep suctioning as you come out. If you get a nice little pocket, a nice little goobery secretion, you can leave the catheter there, take suction off, let your patient recover, but leave the catheter in. And then once they're ready, they've had a few breaths, you can apply suction again and get the remainder of the secretions that you hear. By the end, you're all done. Take your catheter out, properly dispose of everything, clean up your patient, assess, make sure they are in a good, safe position, and reapply any oxygen modality they might have been on previously. So that is nasotracheal suctioning. The biggest thing is to monitor your patient. This is just a little bedside experience tidbit. I will give my patients something to hold on to, because otherwise their automatic reaction is going to be to grab your arm. So I'll be like, I'm gonna have you hold on to this pillow on your chest, or have you hold on to your phone, or blanket or anything like that, because otherwise that'll be their immediate reaction as soon as you start going for their nose, is to grab your arm. So make sure your patient is clean and report any complications such as bradycardia, vagling, epistaxis, anything like that. So come to lab with questions. We will do the best we can with having you guys do this in this COVID world. And we'll see you later. Thanks so much. Oh, throw your gloves away. Bye.